All right, thank you.
All right.
Go ahead.
As I had been reporting for the past several weeks, we saw that our peak in Lake County for COVID cases came at the end of April, which was here. But interestingly enough, now we've seen evidence of a second peak that is happened over this past week. And again, remember, these numbers are small. You know, these are single numbers, and so we did see 4 cases on June 1st, a couple days ago. And then there were 2 cases here at the end of May, I think it was May 25th. And so we are seeing a rise again in cases. We're not seeing that flattening of the curve anymore. So that's new. If you look at our cumulative cases, you can see all of these here where there is this increase in the slope of the curve. So we had the flattening of the curve that happened as a result of our stay at home. And then when we started opening up our economy and doing these safer at home, you can see that there has been now a total increase in cases. And so there's 30 plus, almost 40 cases thus far that have been reported. And remember that our cases are a combination of anybody who comes into Lake County for testing. So both at my office at Rocky Mountain Family Practice and at St. Vincent Hospital. So some of these cases are not shown on the state data because the state data represents only people who actually live in the county. But this is the total number of people that have been tested. We have had people come over from Summit County and from Chaffee County to be tested here just because of our wider availability of testing. Hospitalization, still nothing since the end of April. And again, just a reminder that we have been able to take care of all of our COVID patients with the exception of 2 thus far. So our hospital stands ready and we clearly have the bandwidth to be able to take care of most of those. Our cumulative data, this number is back up again. And so this is the viral RNA PCR. So we saw that start at 17, get as low as 9%, and now it's back up to 11. So that just shows that there are more people who are coming in to get tested for the virus. And there is evidence of more community spread this week than there was last week. And then our antibody test, this number remains rock solid here at 3.4%, telling us that there is still very small amounts of people who have had exposure to COVID-19. Again, my favorite slide, no one has died yet in Lake County as a result of infection with the coronavirus responsible for COVID-19. And then just a quick little reminder to folks that in order to move forward through our stages to be able to go further in opening up things, we have to meet all of these criteria. And now we no longer meet criteria number 1, which is the sustained decrease in cases for the last 14 days. So there's the update. Are there questions about that? So I think there's a question from Ms. Marcella. Would like to hear more about the current cases and the timeline between the cases. If you look at the graph, and I guess I will share again here. These are days on the bottom, and so this 3 or 4 cases here all were tested on June 1st. We had another 1 positive case that looks like May 29th. So there were 3 days between those 2 cases, and then you can just see the dating here for yourself. But we are getting more positives on the same day than we were in previous times, with the exception of the peak that we experienced at the end of April, beginning of May. And then from Mr. Clarkson, is the state experiencing a similar rise? Yes, and so let me look at that. So here is the state data which shows they had their peak at the same time that we had our initial peak in April. We had this lovely decline, and then you can see here in the past several weeks, it's gone up again. So you can kind of, if you look at it from across the room, this line right here is higher than this line. So they are beginning to experience more cases also, just as we are.
Thank you, Dr. Lisa. Are there any other questions for Dr. Zwerdlinger regarding the data? Not seeing any. I don't know if Colleen will actually hang on. All right, Colleen, why don't you give us updates from public health? Thanks.
Yeah, thank you so much. For those of you who don't know me, I'm Colleen Nielsen. I'm the Director of Lake County Public Health Agency. And, obviously Lisa and I, work very closely looking at the data, trying to understand what's happening. And as we think about, moving into the safer at home piece, we recognize that more people are going back to work, more people are, moving about and or gathering in groups of 10. But I think it really speaks to the fact that we have to be mindful as far as our social distancing. And, we keep talking about the same 4 things. And we know that those same 4 things are, maintaining a 6-foot distance, wearing a face covering in public, having great hand hygiene, as well as if you're sick, please don't go out. Please don't expose anyone, no matter what you think it is, if you will. The key about COVID-19 is currently we have the availability to test anyone who has symptoms. So that is free testing for anyone who does have symptoms. And the more information we have about, those folks who do have symptoms, the better we are in the sense of containing that spread, because we'll recognize who that person is, who their close contacts are, as well as contact trace to make sure that people aren't going out and, continuing to spread the infection, which, our end goal truly is, not to overwhelm the systems, not to have a death because of the fact that someone couldn't receive care, whether it's here, or in some of our other partnering all the way down to Denver. So as you can imagine, we're continually looking at what's happening across the state and how it might relate to Lake County. So there is some mobility data. I don't have it broken out to Lake County yet, but it is truly showing that as a region, which currently our region for this particular number would be Lake County, Chaffee County, Park County, Teller, and El Paso, shows that as far as our social distancing, and if this sounds familiar or you have questions around it, like this is a great time for us to really work through it. Like it's not a matter of, responsible reopening. It's recognizing, what's happening across all our communities. And so with the social distancing, the state ideally would like to keep the whole entire state above 55%. And we were doing really well at the safe at home order. We were closer to 65 to 70% of social distancing. But as we move about, especially here in this region, we're at about 40% social distancing. And we know that the next surge, or per the modeling data, which we know is not perfect because it continues to change weekly, is that at 45%, we increase our risk of actually having the surge occur sooner and or like tomorrow, if you will. We also recognize that that number, because we're lumped in with some of those larger counties, doesn't necessarily reflect what's happening in Lake County. I want to say that what I'm seeing in Lake County is looking really great. I see people out in public with their face coverings. I see folks on the trail stepping aside and making sure that, you're making space and maintaining that 6-foot distance. I think that's great when I hear, folks like, oh, where's the hand sanitizer? Or and wash my hands. Like, that's fantastic. I think we're really getting there. And I would like to keep staying on that positive trajectory so that we can continue to kind of monitor the situation, fulfill those criteria and, and slowly responsible reopening. But as you can imagine, we don't quite meet those criteria right now. The governor did come out with additional orders in the sense of all short-term rentals were able to open on June 1st. And now tomorrow there'll be guidelines coming out around personal recreation and outdoor recreation, which includes guides and outfitters. And the personal recreation includes, what activities people can do in group size, but group size still is 10 people or less. And we're asking folks to really think about folks coming together with folks that know some of the things we're finding, and especially when it comes to contact tracing. So the way that works is that we get a report that someone tested positive. We reach out to them and we figure out who those close contacts are, and or somebody they would have interacted with in a space less than 6 feet, greater than 10 minutes, and we kind of go from there. What we're finding is people are starting to gather is that they don't know everyone who's in that group. And that's not very helpful when you think about it in the sense of, well, if you gathered with a group 10 more and you didn't know, even if you're in a group of 10 and you don't know all 10, it's very hard for us to figure out who those other folks are to make sure that they aren't spreading the infection unintentionally, because as we know, a lot of folks are asymptomatic. About 50% of cases are asymptomatic, but still have the ability to spread the virus. And so I think it's something too that, as a community, we have to recognize of, hey, like, there's a lot of personal responsibility. And if you're going to go into a group, you should be aware, because if you don't know who these other folks have been with, and say they've been out in a group of like 20 and 20 and 20, and you can imagine how quickly that little tiny web of a couple of contacts turns into over 100 people that we're trying to figure out who they are. And if you don't know who they are, then it continues to spread throughout our community, when the key is really, containing that, like our surveillance, our monitoring, and then containment of, those infections, if you will. So something to think about. And that's kind of the reason why we're still at, groups of 10, because we recognize that the most prevalent places that it spreads is when people are gathering in groups. So that's just something to think about. But I just want to say thank you. I know it's been tough, but I think as a community, we continue to do some really great messaging, and people are really figuring out, people have come together. Like, even I would say some things that I recognize that I've not done 100% well, but what's really come out is it's allowed, different organizations to kind of come together, unify, and realize, hey, this is what we need. And I totally appreciate that. So there is a silver lining to some of this. And, as you can imagine, when I think about, some of the missteps, if you will, that have happened in the last couple of weeks, are like, oh, we didn't do that piece, or maybe we need to do this piece. So I also have to recognize that, there has to be some grace, in this process, considering like no one's ever gone through a pandemic before. And I think we have to remember that we're still in the middle of a pandemic. Like, this is not something just because we're starting to reopen means that we have nothing to worry about. Like, this is with us until we have a vaccine and or we have some really effective treatment for it. So I want folks to keep that in mind, that this is a marathon. This isn't a sprint. We recognize that there's some pieces we could have done better, but we appreciate the feedback. This is another venue and opportunity to provide that feedback, and so that we can continue together as a community, moving forward in a positive way. So thank you so much for being here, and we can open it up at that point.
Thank you, Colleen. We have a question regarding, what does it mean? Could you talk about going backwards in restrictions? So, were we to need to revert?
Yeah, absolutely. So, no, I think that's a great question. So, right. So a lot of like, I hate to use the word threat, but the threat is like, hey, if we are not able to do this well, and we're seeing an increase in cases, and we're not hitting all 5 of those criteria because we're seeing an increase in cases. We are not able to contact trace everyone effectively. We see that our local hospital is starting to fill up, as well as, our partner hospitals, and, down in Denver, and people aren't maintaining social distancing, and we're seeing, more crowds, more gatherings. And I'm missing one of the criteria, and I can't remember it. I don't know, Lisa, if you can pick it up off your slide. It was the social distancing, the the hospital capacity, our capacity, no increased cases, and contact tracing. I got them. I got all 5. Never mind. I got it. Thanks. And so with that being said, the reality is for us to really move backwards is, how are we going to do that? Are we going to be able to do that? Would we actually be in a worse position if we all of a sudden said stop and we have to revert? Because I'm going to tell you, just even in the pieces of us trying to slowly reopen, the resistance and things that are happening, I think it'd be difficult, and I think it'd be worse for our community. I think it's really important that we stay where we're at and continue to do all these pieces really well so that we can move forward. I would not want it to be that people finally recognize that, hey, maybe we're not doing this so great because there's, an increase in, a death rate, or we have multiple deaths, here in Lake County, which is something, that we want to prevent overall, in the sense of, we want to make sure people can get to the care that they need. And obviously sometimes we cannot control if someone, does, die in that situation, but at least we gave them their best shot. And so when I think about moving backwards, I don't know if that's really feasible, because I feel like it will actually be the opposite, where more people will rebel versus, hey, can we just do this piece really, really well? And that's what I'm asking currently.
Thanks, Colleen. Next question is, what does the rise in cases statewide mean for state guidance?
So at this point in time, because the criteria is being met, those 5 criteria are being met, that the guidance will not change. So obviously, if there's something happening statewide, I'm hoping, so I guess that does address that point of going backwards. If something truly is happening statewide, I'm hoping as a community that we can recognize that, hey, maybe for our best, interests, that we might have to start going backwards. But my intent here is to stay, where we're at. So at this point in time, nothing has changed. That would be a governor's order recognizing, hey, these criteria are not being met. But I think the cool part, really cool part, and I don't mean to sound, is the fact that it's all within our control. It's all about how we interact both in our community, we're visiting other communities, and that's the biggest piece of the puzzle, is we actually have control over that, in the sense of, personal responsibility and behavior. And I think that's why, the governor continues to push out, like, do your part, do your part, do your part, right? And so if there was something, we should be able to see it coming, in the sense of whatever we're doing today, we will not understand the effects until about 13 days later. Currently, the current data shows that from the time of infection to the time that someone's hospitalized is about 13 days. So you can imagine that there's some catch up and some lag on that. But if, obviously if they see an increase in hospitalizations, like, we're going to get that trigger, we're going to get that message, and we're going to push that out to our community, because, we might be able to stay where we're at and keep our community isolated from a lot of those cases if we truly are doing all of those, 4 measures. We keep kind of like hammering home, if you will.
Thanks. And then the second part of the question is, will the state consider a variance from Lake County if we are not meeting the criteria?
And so currently we wrote for a variance, but almost everything that we asked for in the variance was actually going to happen this week. We weren't too sure what was going to happen, and we wanted to be proactive and make sure that we put in a variance for our short-term rentals, for our playgrounds, for our rec programs, for some of our private clubs, as well as an educational institute here. And so at this point in time, so much of what we asked in the variance is happening this week. They will be looking at our numbers. I'm going to tell you that it doesn't look good, in the sense of, what's so hard, right, about the numbers is when they put it in, the big picture, they talk it per like 100,000. We have approximately 8,000 plus, here. And so when we think about that, there's different categories, if you will. And because we doubled our cases, which didn't cripple us in any way, but that bumps us into what they would say like a moderate to moderately high incidence rate. And that's kind of what they're looking at. And like the highest is, high. So we're kind of like right in the middle. So I don't think the other 2 pieces that we asked for a variance are off the table. But if there's something specifically that you're looking for in a variance, in the sense of, currently we are following the governor's orders at this point in time. We have been following the governor's orders since the beginning. The only part that we deviated from was truly that short-term rentals. We weren't asking folks to come into our community, especially in the beginning. So now that that's been released, we're almost in perfect alignment with the governor's orders. So I don't know if there's like a question about a variance to do something different in Lake County besides what we've already, have already asked for and or is happening this week.
So we're seeing a small rise in the state and locally. I'm a little concerned. Should I be?
It's really in the sense of, we're able to currently handle that. I think there has to be recognition that our cases are going to continue to increase, right? If folks are not following, those social distancing, if you are somebody that is in a vulnerable group and or in a, a higher age group, part of the recommendation is, if you are 60 and or 65, depending on what source you look at, the recommendation is still to stay at home. And the order that we're in is still safer at home. You are truly safer at home. They talk about the vast outdoors and having that opportunity to recreate, but not in large groups, in, your small group. So I think that is something that, you have to make that decision for yourself, in the sense of, how that may or may not affect you. Obviously, if we, double in the next week. And or, the big thing is if we know who the folks are and we can contact it and we can, contain it, that's kind of the key and what we're trying to do. So I think a piece of that is asking for cooperation. So if you're able to push that out to your family and friends, like, hey, you may get a phone call because you might have been exposed, that is really helpful. The more information we have in order to contain it, the better we are as a community. And so by not sharing that, sometimes what happens is that it will continue to spread and, we'll just be behind, if you will, which is not what we want. We want to be proactive.
And if I can add, the big push here is, yes, you should be concerned enough to wear your face mask every time you go outside. And if scare tactics work, wear your face covering, because that's clearly how we make a difference. And when you see someone who's not wearing their face covering, say something to them. If you have the ability to carry a couple face coverings in your pocket to hand out to those who don't have them, give them away. But we lead by example, and I keep saying that over and over again. And yes, we should be concerned enough to make sure that we recognize that if the virus is still there, it's not gone anywhere, and that we are seeing an increase in cases, and we need to be very diligent in what we're doing so that the spread does not continue to increase.
Thank you, Lisa.
So I'm not seeing any more questions in the chat. Are there any questions that you would like to verbalize? You can unmute yourselves, or if you are on the phone, you can unmute yourself using *6.
So I would share, if you don't have anything now, or you think of something, like, please reach out to us. Like, our processes can always be improved and be refined. Like, feedback is a gift. And so if we don't know what folks are struggling with, or, hey, I think this is a really good idea, I think people would get it if you said it this way, right? Like, I only think a certain way. Some folks think, obviously we all think differently. That's super helpful as well. Like, anything we can to get like the word out, and in different ways, like, we're totally open for that. I think that's kind of, the crux, right, is making sure that people are getting the right information. So anything that you can help with that, we appreciate. Or ask, family and friends, this is your opportunity, obviously in these meetings as well, to bring that forward. And so I just want to say thank you.
Question, is there an update on insurance companies' coverage of certain tests?
Unfortunately, no. As I addressed before, we initially had thought that insurance companies were mandated by the feds to cover all COVID testing. Some insurance companies have found loopholes that they will not pay for people who do not have symptoms. We are in contact with our legislators in an effort to try and change that, but there is no update.
There's a request, Colleen, if you could speak to the consequences of Lake County not complying with the state public health orders, and what that could mean for Lake County, if you could share that here, as you did yesterday with the commissioners.
Yeah, absolutely. I appreciate that, Commissioner Marcella. I think the number one thing is, people's health, right? That's like the number one consequence is that we will have more people sick and overwhelming a healthcare system, and we won't give people their best shot, and we will have death. We might have death no matter what, like I said earlier, but that is something that if we can give someone their best shot to get to healthcare, to get the care they need, then I feel much better about that than, hey, we didn't have a bed for you, therefore we don't, you died, right? I mean, that just sounds horrible. And so, like, that's our number one thing. And I don't know, Lisa, if you want to add to that, and then I'll speak about like my actual particular public health consequences and how it might impact the community. Did you want to say anything on that, in the sense of, I think we're on that same page of not, that's our number one, right? That is truly our number one, is to ensure that everyone has an opportunity to get the care that they need.
Right, and it's, we keep talking a lot about, overwhelming, our healthcare supply, essentially. And so when we look at other countries and we look at our bigger cities, New York is the one that we always think about. People died in those places, not because of the infection, but because there were just not enough resources to be able to take care of folks. Enough ventilators, enough doctors, enough nurses, enough hospital beds. And we, again, all recognize that there will people who will get sick, and they will get sick for a variety of causes. But what we don't want to do is to have people die because we didn't have the space for them in the hospital. And so if we can all become infected, but at a slower pace that allows us to keep up with, all the other things, heart attacks and strokes and everything else, then, the amount of people that will die decreases.
Thank you, Lisa. I appreciate that. And then when I think of, violating or going against the governor's orders, what happens from the public health standpoint, I don't know if folks recognize that I'm not fully funded through, county dollars. I am funded through both the county support, obviously, which I'm so thankful for. Thank you. I also get support through the insurance companies and some of the direct service pieces that we do. And then the biggest, or shouldn't say biggest, but it's kind of like a third, is through grants. And majority of our grants come through the Colorado Department of Public Health and Environment. And if we are not following what's happening at the governor's orders, right, then we risk losing our funding. We have to recognize that some of the direct service pieces that we do provide to our community is some licensing pieces. So we do license all our retail food establishments. So that doesn't just include restaurants, which a lot of folks thinks about. It's gas stations. It's someone who has like something like a convenience store and things like that. And so, if we're not able to perform licensing, we could lose licensing. And so we wouldn't have restaurants having the ability to open because they won't be able to be licensed because we're in violation. That goes as well. Right now, we have a lot of construction going on. We also do septic permitting, and we work hand in hand with building and land use. And if we don't have the ability to perform, our septic piece, then building and land use can't issue a building permit. And so then that slows down. And so when you think of all of those consequences, we have to recognize that we're all tied into this. It's not just public health says this, it's like, hey, we need to do this for us to, be able to economically, continue to move forward, if you will. And if, if we're not following it and, and it's, we could lose a lot. We have a lot to lose. Like right now, we have a lot to gain by being unified, being, following those 4 pillars of social distancing and following the governor. There's a lot smarter folks up there who are looking at all these pieces. We have access to them. So if there's other questions that I may not be able to answer, I have the ability to reach out to the state, and we do not want to lose that connection, if you will.
Thanks, Colleen. Any other questions? Or Commissioner Marcella, did you want to add anything onto that?
No, I don't think so at this point. I think you hit all of the topics that we had talked about at our meeting on Tuesday that I thought was really important for us to convey here tonight. So thank you both for doing that. I appreciate it. We are working on economic recovery. If you are interested in working with us on that long road ahead, you are welcome to. Our recovery meetings are on Thursday afternoons at 3:30 p.m. We will publish the Zoom link so that you can attend those as well.
Just a comment, sharing gratitude to Dr. Lisa and Colleen for continuing to provide the updates and keeping the community informed.
No, thank you. I appreciate that. And thank you for being here and hopefully passing on that information. As we know, this is recorded and therefore folks can have access after the fact as well.
Hi, this is Jackie Littlepage with Public Health. I have a question for Dr. Lisa. I don't know if you've heard anything, but are there any known complications or issues for Colorado being high altitude compared to the rest of the nation, or are we still looking pretty good? And then how would that high altitude affect Lake County considering we are double Denver?
Yeah, I mentioned at some point today, I think that there was a recent study that someone sent me about the effects of COVID-19 at the extremes of altitude around the world. It started in Bolivia and then has been circulating to other high altitude countries. And interestingly enough, they talk about the protective effect of living at high altitude because our pulmonary tree has made some adaptations that may make it they're less of an inflammatory change when we get infected with the virus. But that is just a prospective study, which doesn't hold a lot of weight. It's just observational, essentially. So I sent them our data, and we'll continue to collaborate about that. But right now, there's nothing clear about that. As far as degree of illness, certainly part of why people don't feel well when they get infected by the coronavirus that causes COVID-19 or any other coronavirus for that matter, is that they become hypoxic, their oxygen levels decrease. And that will happen much more or sooner here just because of our altitude. And so just as with all the other respiratory viruses, you know, respiratory syncytial virus, influenza, people who are infected with COVID-19 become hypoxic, their oxygen levels decrease, and that is much more pronounced up here at this altitude. So you feel worse here than you would, for example, if you were at sea level. So that is still true for this particular respiratory infection, as is all the other ones as well.
Are there any other questions? Well, if not, we'll just say thank you again for joining us this evening. We'll give you a brief break before I expect some of you will be jumping on to the Leadville Sanitation District hearing with CDPHE and City Council at 6. But again, thank you for your time. Thank you for reaching out to continue to be informed. Please spread the word to the community about this as a resource, and we'll get the video posted later this evening for others who weren't able to join us in person. Have a good night.
Thank you so much.